In August 2023, the Florida Department of Education sent a letter to all private school administrators saying that they could not require students to be vaccinated. Furthermore, it went on to say that if schools tried to do this, that they could be fined for it. Now, this created a tremendous amount of confusion, not just amongst parents, listeners of this channel, other educators, physicians, etc. So let's talk about it. Hey everybody, it's Dr. David. How you doing? So today another great topic that brings together the intersection between health, education, and choice when we're talking about vaccines. Now, this letter that was sent out to the administrators, it was part of, in response to, and referencing for that matter, the governor, Ron DeSantis, had signed a law called SB 252 called the Protection from Discrimination Based on Health Care Choices. So this was a letter, this was at the beginning of the school year, and so that's why it was being sent out at that time, because of new policies that were supposedly being instituted at that point. Now, in this letter, there was a statute that was referenced, Florida Statute 381.00319. And that was called the Prohibition on Mask Mandates and Vaccinations and Testing Mandates for Educational Institutions. Okay. Now, in this video today, we are going to talk about what the letter actually said from the Department of Education, why the letter has caused all this confusion, and how the DOE replied to a parent who actually had who had seek an inquiry as to getting more information, what the reasoning might be as to why they sent this letter in the first place. And also, I do want to thank Shari, who helps with this program, the producer of this program, also, who happens to be my sister, who helps out, Shari Kulanu. From past days, you may have heard her be part of the show as well. But I really want to thank her because she is a lawyer by training, and there was a lot to unpack here going through the different statutes and regulations. So it was really important and helpful that she did. So thank you very much, Shari, for doing this work. Okay, so what did the August 2023 letter actually say? And what did it not say? So the original letter, and I've put the link in the show notes down below in the description so you can see it for yourself, as well as the statute that I referenced. And in it, there was a subsection 2A. Now, if you looked at the statute, it said that any educational institution may not impose a mandate on any person requiring vaccination with a vaccine defined under subsection 1. So you had to go into the statute and find these subsections, and all they did was list it. Again, not any mention of this in the letter itself. You had to dig to really find it, that the subsection 1 of this whole thing was referring specifically only to COVID-19 and COVID-19 vaccines, and it was limited to just that, okay? That wasn't obvious to me. It wasn't obvious to a lot of other people because it wasn't in the letter. There was no mention about COVID. It was a general statement about vaccines. Okay, then subject 4A of this, that any school, subsection 4A, any school in violation of this can be subject to up to a $5,000 administrative fine for each individual and separate violation. So a lot of people took this to say, oh, if the state is saying that you can't mandate a vaccine, patients of mine, other people in the public started contacting the Department of Education up in Tallahassee, saying, "Hey, the school is mandating this." Again, thinking that they were talking about vaccines overall, and in particular relative to vaccine exemptions, and we'll get to that in a little bit more. Now, at first glance, this letter did seem pretty straightforward. Florida schools can't require their students to get vaccinated, and if they do, they could be fined by the state. Okay, but many parents were told that by their school officials that the vaccines were required, and so we started looking, and to the best we can tell, this is what we found. Okay, so first of all, the statute that is referring to the letter only, as I said, only is specific to COVID vaccines. Okay, even though the DOE never mentioned in the letter, as I said. Okay, and again, but if the letter actually had mentioned the COVID, it would make it seem, well, why would you think it was just that? It's this letter that went out to all the administrators. Maybe administrators read statutes better than physicians do. I don't know. Maybe I made a mistake on that. Hey, I'm willing to take ownership over that, although it's clear by everybody's reading that this was not obvious. Okay. And now I do kind of question, why were they not more upfront about this? Why did this letter just simply not say this is related to COVID vaccines? It would have made it all clear. None of this would have been a problem, and instead create a lot of chaos about this. Now, let's unpack this a little bit more. Okay. So the state of Florida it turns out when we learn, it doesn't actually regulate private schools. The state's website says about K through 12 private schools. Private elementary and secondary schools in Florida are not licensed, approved, accredited, or regulated by the Florida Department of Education. Did you know that? I actually didn't know that. Private schools are required by statute to complete an annual online survey to gather information for including in a statewide directory of private schools. And of course, that would relative to immunizations. So what they say is that the private schools must maintain for each student individually the Florida Certificate of Immunization, and that's called the Florida DH-680 form. Okay, that's something that every doctor has access to. It's created automatically for when a person when they get their shots, if the doctor and the patient's enrolled in the shots form program, which we'll get to in a little bit. But that's a form that needs to be on file. It doesn't say what needs to be in the form. It just the form itself needs to be on file. Okay. Now the Florida Shots Program, which is the official Department of Health registry, as well as to say what so every time that a vaccine is entered for a student in this system, because it's for students, it doesn't need to be entered for just being alive. This is relative specifically to school. Okay, and whenever this is formed out, then it also spits out information as to what vaccines have not been given, may be due according to the school policy, the school board policies, the mandate for vaccines, etc. Okay, but then there became this. Also one more thing, exemptions. I'm not going to go into a lot of detail. I've done this before, but there are two exemptions that are legal in the state of Florida. There is the, and this again, now, just for public schools, there's the medical exemption. If there's a medical reason why a person can't get vaccinated, there's a religious exemption. There is no philosophical exemption, but a lot of people define their religion in such a way that it doesn't have to be a part of a organized religion. A person's religious beliefs are the religious beliefs, and we'll just leave that at now since I've covered that in other videos before. Okay, so as terms of the private schools themselves, they do not fall under the same freedom of religion guardrails that all the state schools, the public schools, need to cover to follow, and that would also be including public charter schools for those who don't know. But the private schools, as we said, they are not a governmental entity. They basically operate as private businesses. Okay, this means that they have a lot more leeway to choose to not abide, especially to people's religious preferences, such as with vaccine exemptions. Now, when a patient of mine wrote in about this to the Department of Education, this was the response: the Department of Education is not able to exceed statutory authority by forcing a private school to accept an immunization waiver based upon religious exemptions. So that's the formal wording that a patient of mine got after quite a bit of inquiry. Now, in terms of the religious private schools and the issue of separation of church versus state, okay, sacrosanct in our society, the separation of church and state. Okay, but religious schools, since they are completely different, because they, again, and it's even different than non-religious schools, private schools, because some of the religious organizations, like the Catholic diocese, they have their own governing board, and so that is who it's going to come to. So it may not be the individual school that has to follow. If the Diocese of St. Pete covers the whole Bay Area, as an example, so if the Diocese of St. Pete creates a rule, all of the schools that fall under those auspices have to follow that same rule. Okay, now, it's really difficult for the state to override these decisions without infringing on the First Amendment separation of church and state clause, and that's where the issues come up. So, what are my thoughts about all of this? First of all, this letter that came out originally, as I said before, it was written in such a vague manner that, I don't know if this was intentional or not. I don't know why they would be intentional, but it seems like it was, if at the very minimum, a very specific, a very obvious oversight in all of this. Okay, so it very well led the average reader, including myself, to that it was pertaining to all vaccines. That's why I made that first video, because that was my reading of it. Now, as I said up front, this just makes no sense whatsoever why they did this. All they would have had to do in that letter is simply say, starting off, the headline could have said, this is pertaining to COVID and COVID vaccines. Problem solved. I would not be making this video right now if that was the case. Okay. Now it's interesting because that this law, and just as that, that went to, and the statute that was actually being quoted in here also was related to mask mandates, and basically saying that private schools can't mandate masks in their schools either, which is, of course, that is the rule in Florida for public schools as well. So, as part of the same statute, I was really focusing today much more on the vaccine issue, since this was a follow-up to the previous video that I made, but as well, schools are not able to do that. Now, it's interesting because that means, what if, COVID-19, SARS-CoV-2 is one particular virus? What happens then if another virus comes up? And if there's a call by the CDC to do a mandate for masking? What happens is that I am assuming the state of Florida is going to have to go and redo this law, since it was specific to COVID. And that's, again, one of the weird things about it, because understanding how things work up in Tallahassee, you would think that they would have made it more broad so that they wouldn't have to deal with this again. But who knows? Maybe they decided, hey, maybe if anthrax comes around, maybe we do want to have a mask mandate after all. Whether that works for the anthrax, I actually have no idea. For measles, etc. But interesting food for thought. So let me know what you thought. Did you get confused by this as well? Were you confused by my video to bring it up? Did you really just say, that's interesting, Florida be Florida? I don't know. But have a nice day.